Welcome to the MS-Perspektive podcast, Perspective with a K as I'm German. I'm Nele von Horsten, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins. Thanks for tuning in again and welcome to episode number 139, Diagnosing Multiple Sclerosis, how the 2024 McDonald Criteria helped doctors recognize MS earlier. Getting a diagnosis of multiple sclerosis can feel like a long, confusing journey. Symptoms come and go, test results are sometimes unclear, and many people wait months or even years for certainty. But there is good news. In 2024, an international expert panel revised the official McDonald Criteria, the rule doctors use to diagnose MS. These updated criteria make it possible to confirm MS earlier and with greater confidence, so that treatment can begin sooner, a step that can change the long-term course of the disease. The new recommendations were developed by the International Panel on the Diagnosis of Multiple Sclerosis, a group of neurologists, radiologists, and other specialists from around the world. Their work was published in The Lancet Neurology in October 2025. Why the criteria keep changing? Medicine evolves, and so does our understanding of MS. Since the first version of the McDonald Criteria was introduced in 2001, researchers have continued to learn more about how MS develops, how it appears on MRI scans, and which biological markers help confirm it. Each revision in 2005, 2010, 2017 and now 2024 has had the same goal: to make diagnosis faster, more accurate and less dependent on waiting for multiple attacks. The 2024 update is the most patient-centered so far. It integrates new scientific evidence, better MRI technology, and clear rules for rare cases. It also acknowledges that sometimes MS can be detected even before a second clinical episode occurs, if other strong indicators are present. How doctors diagnose MS step by step. Also, every patient's story is unique. The process of diagnosing MS usually follows several key steps. Let's go through them one by one in plain language. Number 1. Clinical symptoms. It all starts with neurological symptoms that suggest inflammation in the central nervous system, for example, vision problems, numbness, weakness, dizziness, or balance issues. Doctors call the first episode of neurological symptoms lasting more than 24 hours a clinical isolated syndrome, or CIS. Number 2. MRI evidence. Magnetic resonance imaging, for short MRI, is the cornerstone of MS diagnosis. It helps visualize lesions, small areas of inflammation and tissue damage, in the brain or spinal cord. To confirm MS, doctors look for signs of dissemination in space, short DIS, so lesions in different parts of the central nervous system, e.g. brain and spinal cord, and dissemination in time, for short DIT, lesions that appear at different moments, meaning ongoing activity. Step number 3, cerebrospinal fluid, for short CSF analysis. A lumbar puncture, spinal tap, can show oligoclonal bands, for short OCBs, specific antibodies that indicate immune activity in the central nervous system. Their presence supports an MS diagnosis, even if MRI findings are borderline. Step number 4, ruling out other causes. MS is a diagnosis of exclusion. Doctors must rule out infections, vascular or autoimmune diseases that can mimic its symptoms. What's new in the 2024 McDonald Criteria? The 2024 revision makes several important changes aimed at identifying MS earlier, but still safely. Here are the key updates. Number 1, stronger role of CSF findings. If a person has only one clinical event, but MRI shows lesions typical for MS, the presence of oligoclonal bands in the CSF can now be enough to confirm the diagnosis without waiting for another attack. This is a major step forward because it allows earlier treatment when the biological evidence is already clear. Number 2, Radiologically Isolated Syndrome, RIS. This is one of the most discussed changes. RIS means that someone has MRI lesions typical of MS, but no clinical symptoms yet. In earlier versions of the criteria, RIS was not considered MS. Doctors had to wait until symptoms appeared. Now, under the 2024 criteria, a subset of RIS patients can be diagnosed with MS if additional evidence supports it. For example, lesions in multiple typical locations, periventricular, juxtacortical, infratentorial, or spinal cord. The presence of CSIF oligoclonal bands, and specific MRI features that predict progression. This change acknowledges what researchers have observed for years. Some people with RIS already have silent inflammatory activity that will almost certainly lead to MS. Number 3, better integration of optic nerve and spinal cord findings. The new criteria explicitly recognize that lesions in the optic nerve and spinal cord count as evidence for dissemination in space. This helps in cases where visual or spinal symptoms were previously not enough to confirm MS. Number 4, clarified definitions and standardized imaging. The panel introduced clearer MRI protocols, minimum lesion numbers for interpretation, and better definitions of what counts as a typical MS lesion. This should improve consistency between hospitals and radiologists worldwide. What hasn't changed? The foundation remains the same. Objective evidence from MRI or CSF is required. Alternative explanation must be excluded. Clinical judgment remains essential. No algorithm replaces experience. But overall, the balance has shifted slightly toward earlier recognition rather than long waiting periods. Why early diagnosis makes a difference? The earlier MS is diagnosed, the sooner treatment can begin, and that can make all the difference for long-term outcomes. Disease-modifying therapies, or DMTs for short, don't just reduce relapses. They can also slow or even prevent the accumulation of disability. Studies have shown that people who start treatment soon after their first event often stay active, mobile, and independent for much longer. Equally important, an early and confident diagnosis provides clarity and emotional relief. It ends the uncertainty that many people experience while waiting for the second attack. What about people with CIS or RIS? If you were told in the past that you have a clinical isolated syndrome, so CIS, or a radiologically isolated syndrome, RIS, it might be worth revisiting your diagnosis. The new 2024 criteria could mean that some of these cases now meet the definition of MS. That doesn't automatically mean treatment is required, but it does mean it's worth discussing again with your neurologist, especially if you have new MRI findings or if your last evaluation was several years ago. In summary, the 2024 McDonald Criteria allow earlier and more precise diagnosis of MS. CSF findings now play an even stronger role. Some people with RIS may already meet the definition of MS. Early diagnosis offers the possibility of earlier treatment, offers the possibility of better long-term outcomes. MS remains a complex disease, but these updates mark a major step forward toward timely care and improved quality of life. To sum it all up, knowledge empowers us patients. If you or someone you know is living with CIS, RIS, or early signs of MS, consider talking to your neurologist about the new diagnostic guidelines. Medicine is always evolving, and thanks to ongoing international collaboration, people with MS today have a better chance than ever to get the right diagnosis at the right time and start treatment that truly makes a difference. And if you want to check out the source, it's based on the International Panel on the Diagnosis of Multiple Sclerosis, McDonald Criteria Revisions 2024, published in The Lancet Neurology in October 2025. And you can find the paper on PubMed. I have the link in the show notes and, of course, in the blog article. So we are at the end of this episode. I hope you learned something new and got inspired maybe to talk to your neurologist or to talk to friends who have received an CIS or RIS diagnosis. And yes, future looks bright for us, even so it's not always easy. But as you know, please stay as positive and active as possible and rate the podcast wherever you are listening to it or recommend it to somebody who might be interested in the topics. And see you next time. Bye! Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. See you next time.